Hi, I'm Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. It is September 9th, and this is our weekly COVID update. I'm here with Hannah today. Do you want to introduce yourself?
Hi, I'm Hannah. I'm the epidemiologist with the UG Public Health Department.
All right, well, glad to have you on here. Interested to talk with you today about letting folks know what the latest guidance is in Wyandotte County if someone is exposed to COVID or if they test positive for COVID and what they need to know. So let's start by talking about what if someone is exposed to COVID, what should they do?
Sure. So fortunately, over the past year, this has stayed pretty consistent. If somebody is exposed to somebody who has tested positive for COVID during their infectious period, they should quarantine for 14 days. An exposure is classified as somebody who has been within 6 feet of somebody positive for COVID during their infectious period for 10 consecutive minutes. Somebody who has COVID is infectious for 2 days before their symptoms start, and then the following 10 days after their symptoms start.
All right. So, is it different if you're vaccinated, if you're not vaccinated?
Absolutely. One of the reasons I love vaccines is that if you are vaccinated for COVID and you are exposed to COVID, you do not have to quarantine for 14 days. You should continue to monitor your symptoms, and we encourage testing as well as mask wearing. However, you do not have to quarantine.
All right. And when should you get tested?
You should get tested 3 to 5 days after your exposure.
Okay. So if you're not vaccinated, you can skip quarantine, but still get that test 3 to 5 days later, wear your mask, take your other precautions. If you're not fully vaccinated, you need to do that 14-day quarantine and also get tested.
Yes, that's true. We definitely encourage testing if you are unvaccinated and exposed. COVID is very transmissible, so it's important to know whether or not you've tested, or you definitely have it.
Okay, great. So that's just if you are exposed to COVID. What if you get tested and it comes back positive that you have COVID? What do you need to do next?
Sure. So the first thing to know is that you are infectious for COVID 2 days before your symptom onset, or if you don't have any symptoms, it's 2 days before your test that you submitted for a COVID analysis. You are also infectious 10 days after that test if you're asymptomatic, or 10 days after your symptoms start. So you have to isolate for 10 days after your symptoms started, or that positive test if you are asymptomatic. It's important to know that you should notify all your close contacts who you have maybe potentially exposed, because they will need to quarantine for 14 days unless they're vaccinated. It would also be good to get your household tested as well, since they are going to be a very vulnerable group around you, since you are all sharing living spaces.
All right. So if you do have symptoms and you've stayed home for that 10 days, is there anything else that you need to be watching for or need to keep in mind before you stop staying at home?
Sure. So you do need to be fever-free for 72 hours. Not everybody with COVID gets fevers, but if you do, that's a sign that you could still be infectious. So you need to be 72 hours fever-free without using any Tylenol. It's also important to note that if you have issues like difficulty breathing, that you should go to the hospital to see a doctor. As long as your symptoms are progressing normally, though, usually you can just leave isolation after the 10 days.
All right. So we've talked about what you're supposed to do, but can you talk a little bit more about why it's important to follow these quarantine or isolation procedures?
Right. So it's definitely important to isolate while you know you are infectious, because otherwise you're putting the people around you in danger. If you work at a school where you are around unvaccinated kids, that could be dangerous. If you work in a nursing home around older adults who maybe have other health issues or are immunocompromised, that could be very dangerous. Really just being out in the public at the grocery store, you don't know who you're around. So it's really important to stay home while you know you are infectious. And it's equally important to stay home while you know that you've been exposed, because you could potentially be infectious, since that infectious period starts 2 days before your symptoms start. You could be walking around feeling totally fine and be spreading COVID without even realizing it. So that's why quarantine and isolation are both very important.
All right. So it sounds like that's sort of one tool that we have to help reduce the spread that we've been seeing that's been pretty high recently in Wyandotte County. I know people have heard a lot about this, but just to reiterate, what else can people do to reduce that spread of COVID?
Right. So always masking whenever you are in indoor situations or crowded situations. Masks have been shown to work over and over again. Getting vaccinated is super important, especially now that Pfizer has gotten FDA approval for their vaccine. It's been proven to be safe. Breakthrough cases happen, but they are a small percentage of our cases that come in. So that's a very important mechanism for prevention, and always being mindful of your surroundings, staying out of that crowded bar, staying, with people that kind of their habits are always important, and just doing the best to protect yourself and those around you.
A small thing, you mentioned the term breakthrough cases. Can you explain what that means?
Sure. So a breakthrough case is when someone tests positive for COVID after being fully vaccinated. And being fully vaccinated is 2 weeks out from your final vaccine. And those do happen, but they happen at a much smaller, just like a much slower rate than normal COVID cases. And what we found also is that most of the cases who are being hospitalized or who are dying are unvaccinated. So we found that these vaccines do really work. They help prevent spread. They help prevent severe illness. So we would definitely recommend that you get it if you have not gotten it yet.
All right. Thank you so much. I want to just wrap us up by reminding folks where they can find out some more information. If you want to learn about where you can get vaccinated or find other free COVID-related resources, you can go to wycovaccines.org. You can also call 311. You can also find places to get tested for free, as well as some other COVID-19 information. That's at wykokck.org/COVID-19. All right, thank you so much. We'll see everybody next time.
Thank you.